Good morning. My name is Dr. Suchetan. I am an associate professor in the Department of Chemistry, Bioscience and Biomedical Engineering at IIT Bhilai. First of all, I want to thank the organizers for giving me this opportunity to present in this conference. The title of my presentation is Glucose Responsive Hydrogels Towards Artificial Pancreas. In our laboratory at IIT Bhilai, we are interested in various drug delivery problems using hydrogels. We are developing the glucose responsive hydrogels for smart insulin delivery. Secondly, we are fabricating novel antibacterial hydrogels. In third project, we are working on preparing novel hydrogel formulations for cancer theranostics. In today's presentation, I'm going to focus on our efforts towards development of smart insulin, that is, development of glucose responsive hydrogels for insulin delivery. And I'm going to explain what is glucose responsive hydrogel and how it will help for smart insulin delivery. Insulin secreted from pancreas plays an important role in controlling blood glucose levels in healthy individuals. Insulin is released from the pancreas in a glucose-dependent manner. That is, when the blood glucose level is elevated, the insulin is produced more, and that in turn helps lowering the blood glucose level. This maintains the average blood glucose level below the threshold of 120 milligram per deciliter. And obviously, this mechanism is impaired in the type 2 diabetes patient. That's why the average blood glucose level is elevated compared to the healthy threshold. To maintain the healthy blood glucose levels, insulin injections before meals is prescribed in type 1 and advanced type 2 diabetes patients. However, insulin injection does not mimic the biological insulin production from the pancreas. Also, insulin injections are painful and inconvenient and cause ulceration and fatal hypoglycemic events. To alleviate this issue, researchers are developing pancreas-mimetic glucose-responsive hydrogels that can sense glucose environment and release insulin according to the blood glucose level. To achieve this, the glucose-sensing molecules are installed in the hydrogels. There are two types of glucose-sensing molecules. Number one is protein-based glucose-sensing molecule, such as glucose-binding protein and glucose oxidase enzyme that are installed in the hydrogel. Number two is a protein-free design in which phenylboric acid or PBA molecules are embedded in the hydrogen matrix. The PBA is known to form Boehner ester bonds with the cis 1,2 or 1,3 diol present in the glucose molecule. The glucose sensing molecule change its properties of the hydrogel that further release the entrapped insulin that is present in the hydrogel under hyperglycemic conditions. In our lab, we are interested in PBA-based design because of its reliability and robustness compared to the protein-based design. Currently, PBA-based glucose-responsive hydrogels are synthesized from PBA-containing polymers. PBA-containing polymers are made polymerizing PBA-containing monomers or functionalizing a existing polymer with PBA molecules using suitable chemistry. However, there are some drawbacks in these current methods, such as complicated synthesis. Secondly, they are expensive and not scalable. Third is the polymers are not biodegradable, so they are not suitable for internal use. Fourth is the unpredictable nature of structure and function relationship. To address this issue, our lab has developed strategies that are easy to execute and scalable. In our lab, we are expanded the library of PBA-based hydrogels by cross-linking commercially available diol-containing hydrogels such as polyvinyl alcohol with phenyl bisboronic acid. We further discovered that simple aliphatic bisboronic acid and their pinnacle esters were able to form glucose-responsive hydrogels. Further, we designed novel and easy-to-make hydrogels by cross-linking a polyamine with polyvinyl alcohol using a heterobifunctional cross-linker, formyl phenylboronic acid or a PBA. Two polymers are cross-linked via an imine and a boron ester bond that are formed in situ and that allowed instantaneous formation of glucose-responsive hydrogels. The glucose-responsive hydrogels are formed by simple mixing of three components: polyamine, polyvinyl alcohol, and a PBA. PBA is first loaded with insulin followed by mixing with polyamine. Then a PBA crosslinker is added. The glucose-responsive hydrogels are formed immediately, as you can see in the video, and it is ready to be used. This is unique in the field of glucose-responsive hydrogel. The interesting feature of our design is that we can replace the synthetic polyamines with biomolecular polyamines such as different proteins, for example, globular protein like serum albumin, or amine-containing polysaccharides such as chitosan. This allows the fabrication of hydrogels from sustainable and inexpensive sources. As a proof of concept study, we have cross-linked bovine serum albumin with polyvinyl alcohol by phenylformylboronic acid or PBA-based bifunctional cross-linker molecules. The hydrogen matrix is formed due to the formation of boron-ester bonds, which is both pH and glucose responsive, as well as a pH responsive imine bond between the lysine residues of the protein and the APBA crosslinker. Now, we can select the APBA crosslinker from the library of different positional isomer of APBA such as 4-APBA, 3-APBA, and 2-APBA, and their fluoroderivatives such as 2-fluoro-4-APBA and 2-fluoro-3-APBA. We hypothesized that different crosslinker would create different crosslinking densities that will change the mesh size and non-specific leaking of the entrapped cargo, and that further will change the glucose-responsive insulin release properties. The choice of APBA crosslinker would help identify the optimum hydrogel for glucose-responsive insulin delivery applications. We tested our hypothesis by making hydrogels with 5 different APBA crosslinker. Due to the different molecular structure, all APBA crosslinker produced hydrogels with different bulk rheological behavior. 2-fluoro-4-APBA and 2-fluoro-3-APBA produce relatively stronger gels compared to the 4-APBA, 3-APBA, and 2-APBA due to the enhanced cross-linking ability. Next, we performed the insulin release assay at physiological condition under two different glucose environments. 0 millimolar shown as the black curve and 100 millimolar shown as the red curve. The measurements were done at 1, 2, 3, 4 and 24 hours time point. And in this slide, I am showing you the data of 2-fluoro-4-APBA and 3-APBA, a hard and soft hydrogel respectively. Below is the plot of glucose-specific release, which is the difference of 100 millimolar release and 0 millimolar release. From the data, it is evident that 2-fluoro-4-APBA show less glucose-responsive insulin release properties compared to 3-APBA. Therefore, we can control the glucose-responsive insulin release properties by changing the chemical structure of the crosslinker. Moving on, we have further employed the same strategy by chemically cross-link chitosan and PVA with a PBA crosslinkers. Now we have asked if the size of the molecular cargo is important for the glucose responsive release profile from the hydrogen. Here we have employed a small molecule cargo fluorescein and a macromolecular cargo insulin. Again, we have performed the insulin release assay from chitosan polymer hydrogels at physiological condition under two different glucose environments, 0 millimolar and 100 millimolar. From the detailed analysis of the data, we can conclude that small molecule cargo show less glucose-specific release compared to the macromolecular cargo, and this effect is particularly prominent in acidic pH and earlier time points. Inspired by the excellent glucose-specific release of insulin, we tested the insulin-loaded chitosan polymer hydrogels for anti-diabetic application in vivo rat models. In this study, diabetic rats are injected with hydrogels shown as black curve, only insulin shown as red curve, and hydrogels loaded with insulin shown as blue curve. The plots show the blood glucose levels of these three groups at different time intervals. We can clearly see that hydrogels loaded with insulin can maintain significantly low blood glucose level up to 24 hours. These results suggested that these hydrogels are promising for clinical translations. For clinical translation, we are currently developing microneedle patches using this hydrogel material for pain-free and sustained insulin delivery in insulin-dependent diabetes patients. As I am running out of time, I want to summarize. In this presentation, you have seen that our lab has developed a new generation of easy-to-make biomimetic smart insulin out of biopolymers and biocompatible polymers. These hydrogels show excellent anti-diabetic properties in vivo. In coming years, our lab will be developing pain-free and sustained insulin delivery system for better management of diabetes. At last, I want to thank my students who worked tirelessly for this project. Also, IIT Bhilai for providing the facility, and SAR, DBT, HDFC for providing funding for doing this research. I want to thank the organizers for giving me this opportunity, as well as thank you for your patient listening. Thank you.